So from my end, I've tried to put less material to which confuses you rather than it would be better if we can interact. So if there is any questions you have within the chat or within the while I'm teaching or after, you can let me know in the chat box. That is okay. And other than that, if at any point you feel like I'm going overboard or you're not understanding, please feel free to let me know and I can adjust accordingly. And again, it would be a lot better if we can interact a little bit. So, is my audio and everything is okay, sir? Can I go ahead?
Yes, doctor. Your everything, your voice is clear, your screen is visible.
Sure, sure.
Okay,
Thank you. Okay.
thank you,
All
doctor.
right. Thank you. So, the topic for today is psychosocial intervention. So, if you see, I have put psycho and social in different colors. So, in psychiatry, at the outset, I would like to tell you that whenever we talk about any psychiatric condition, just like addiction, we now follow something called the biopsychosocial model: biological factors, psychological factors, or social factors. So, into our understanding, uh, all these factors together play a role for an outcome to occur. And at the same time, just as important as all of them are there to be present, it is also important for us to understand they are distinct. So, biological factors are distinct, psychological factors are distinct, and social factors are distinct. So, at this point, when we are talking about psychosocial interventions, it is very, very important for us to understand the fact that biological factors in the biopsychosocial model might not always be modifiable. There are things about, if you say about genetics, we can't change it. By psychological and sociological factors, there are some things we can do about it. So that is why these interventions are very, very important, because again, psychological and social interventions will help you in long term. Biological, okay, you'll give medications, you'll make some changes, but what about the long term management? The psychological and social factors, till you don't manage them, the long term management will not be complete. Okay. So we'll start with, first of all, what is addiction? So I'm sure you'll have more lectures in this, more modules in this, where you'll be able to understand more about addiction. But I wanted to just bring in this point. Drug addiction will likely remain in the current vernacular, but it fails as a medical term. Why is this important? So drug addiction nowadays, if you talk to me, I am a new generation psychiatrist. But if you talk to somebody who's a very old generation psychiatrist, they might say things like drug addiction. Now it is so stigmatizing to use these words. You cannot use the words addiction so freely like you used to. So they are, changing to dependent, they are changing to use, they're changing to use disorder. But it will likely remain in the current vernacular. So we are very used to saying drug addiction, this person is a drug addict, this is that. But as a medical term, it fails, because what is addiction? You can't really medically always justify it. So it is very important for us to understand that even though the term is drug addiction, I would suggest, when you're working in your daily practice, especially when you're talking to patients or clients who are, well educated, try to refrain from using words like drug addict. You can use words, you can say things like, I understand that there is some dependency, I can understand that there is some use. These things are causing such problems, and we can talk about it and we can take this further. Try to refrain from using negative stigmatizing terms like addiction or drug addict. The second point, which is very important here, is it is impossible to ascribe a precise point at which drug misuse can be classified as drug addiction. So I would like to give you an example here. Suppose you're dealing with a patient, and the patient comes and says that I have been consuming alcohol or I've been consuming marijuana for the past 20 years. In the past 10 years, it has increased. Now, can you at any point precisely say that this is the point where he or she became dependent on it, or he or she became an addict in vernacular? No, it is very difficult. If you take history, if you take an understanding and talk to the patient, he'll say, yes, from 20 years I was using. Initially, I was using this much. Now I'm using this much. But I don't know when is the point exactly where I am actually becoming very dependent on it. So it is very difficult for us to say that at a precise point, this is where the drug misuse or the drug use became an.
Addiction isn't just a habit, it's a medical condition. It changes how the brain works and controls behavior. Addiction medicine is a specialized branch of healthcare. It focuses on prevention, diagnosis, and treatment of substance use. Experts use evidence-based therapies and medications. Counseling helps rebuild emotional control and confidence. Support networks are vital for long-term recovery. Treatment restores body, mind, and spirit. Recovery brings back hope and connection.